Good morning. How is your day going?
Not too bad.
Oh, that's good.
Really good.
Let's start by introducing myself in here. My name is Robin Karumathy. I'm one of your trainers in teaching the nursing care plan in your training session. Just a bit about myself. I did my initial nursing degree in Delhi, in India. Did that, and then I came to Australia on 2010. And since then I have been working in mental health sector as a registered nurse. And then during that time I understood my passion. I realized my passion in training and assessment, and that's what I'm doing now, and I hope you feel the passion that I have in me too.
Yeah.
Okay, can you please introduce yourself?
My name is Robin.
Mm-hmm.
I came to Australia about 8-9 years ago. Since then I was working in an aged care or side care leading staff. After that I feel like I wanted to do nursing, so I just thought I'm just going to start it now. So, yeah.
Okay, good. So by the end of this course, you will be applying for your enrolled nursing degree through APRA?
Yep.
Okay, that's good. It's good that you already have some idea about the medical sector itself. It's not new to you.
Yeah.
That's a good thing too. Okay, so welcome to this training session. I just want to tell you what we be covering in this training session.
Mm-hmm.
We will have 2 training sessions, both 30 minutes long, and during this time we'll give you a brief overview of nursing care plan. Have you ever heard about nursing care plan?
I heard about nursing care plan in my workplace. The nurses, they make the care plan.
Okay. So today we will make a care plan, and you will make a care plan yourself. Okay. Can I give you this attendance form? If you could just put the session 1 details, please. Your name and just an initial in the session 1, please.
Do you need the full name or?
Yes, please. You can leave that with you, and I'll come and collect it later.
Yeah, thank you.
Just a bit of ground rules before we start. Letting you know that our nearest exit is the door over there, and that will lead into the assembly area outside in case of an emergency. Catering will be provided after the training session.
Wonderful.
And I hope the people that are helping with the catering have already received your allergy and dislikes and details and all. And there is a first aid kit available in the cupboard nearby as well. Okay. Okay. So let's. I'll just give you a glossary. This tells you the main terms that are used in the training session, just for your glossary. Okay, so this is, sorry, I'm giving you too many papers in this session. So let's start here. First of all, I just wanted to get your opinion of what a good nurse is. What would you consider a good nurse is? What are the qualities?
I think a good nurse, they should know the patient's condition, and they have to work according to the patient's situation.
Would you consider that as a knowledgeable nurse, and a nurse who knows what she's doing?
Yeah.
Like she is confident in her training and her knowledge? Yeah. Would you please note that down on the handout provided? Just a quick, brief
Yes,
notes.
sure.
Yes. So would you say the nurse is knowledgeable? A good nurse will be knowledgeable.
Knowledgeable person.
Knowledgeable. I'm sorry. Sorry, it's a hay fever season.
Yes, everywhere now.
What else do you think are the qualities that makes a good nurse?
I think the nurse should have some sort of empathy.
Empathy.
Yeah.
Empathy can be the next quality. Just another couple more that you can think about.
I think a nurse, in the aged care settings, I know much
Mhm.
more. The nurse usually talk for the residents.
Advocate. So
Okay.
the nurse is advocating for the
Yeah.
for their patients,
Patients.
isn't it?
Yes.
So be a good advocate for the clients. Just one last one that you can think about.
Should a nurse be a polite person? I don't know.
You can say that she should be polite enough to because the person the patients in her setting, in her clinical setting, are vulnerable, isn't it?
Yeah.
Would you agree with that? Like the patients or the family members in a hospital setting are in the low, most of the time it would be a vulnerable state, isn't it? They no one wants to be sick, no one wants to be
That's right.
ill, or if it's a parent who is having their kid in the admitted in the hospital and he's unwell, you want to be polite enough to understand
Yes.
their feelings and emotions and all that. Would you agree with that?
Yeah.
Yeah. So you can say polite, yes. Can I contribute some from my thoughts about a good nurse, and just let me know if you agree with it or not. So most of the times a patient or a family member may not be able to say verbally what they're feeling, isn't it? Sometimes we have to assess that patient or a family member and understand the non-verbal communication from the nurse's part, from the patient's part. The patient might be sitting alone, withdrawn, not talking too much. There might be many emotions going in their mind. They might be sad, they might have just received a bad news from the doctor. They might be thinking about their family back home, missing their family. They might be too far away from the family that they can't come and visit the patient. There might be too many things happening in the background, isn't it? So a nurse should be able to assess a patient's feelings and what's going on. Sometimes the patient would be able to say it, and sometimes not. It can be verbal or non-verbal. According to that assessment the nurse has made, the nurse should be able to deduct the what's going on, isn't it? Like say the patient, you're seeing a patient sitting alone, withdrawn. That would mean the patient might be sad. So, or the patient is missing their family. So that's the deduction. That's called the diagnosis, a nursing diagnosis, not a doctor diagnosis. You can't just go and say, oh, that patient has got a terminal cancer or anything. That's not our role, isn't it? But we can make a nursing diagnosis that the patient is sad or the patient is unwell. So that's a nursing diagnosis. what can be done after that nursing diagnosis is made? Say if you're finding a patient who is sitting alone being sad, you can do something about it.
Yeah.
Would you say that? Yeah, you can go and help
You
and
help
do
them.
something.
Sure.
Yeah, talk with them, spend some time with them, provide them with coffee or tea or something. There might be different sort of implementation. That part is called implementation. And then after the implementation, what would you do? So you're sitting with the patient and you're spending some time with them. What else can be done after that?
I'll assess the patient
You-
to make sure that the things I have done, whether it's working or not.
Working or not, exactly. That's called the evaluating part.
Okay.
So you're implementing something and then you're evaluating, did it work? What I did it help the patient in any way, shape or, is there something better that I could have done? You can ask for the patient's feedback.
Yeah.
What I did it help you? What else can I do for you? Can I do it a bit more better?
That's right.
So that's called the evaluation part. And then comes the last part, which is you have to document.
Document everything.
If you don't document, you haven't done anything.
That's right.
Isn't it? Like you can say in a court that in a legal court that yes, I did all this for the patient, but unless and until there is a documented proof, the court won't accept it, right? And hopefully we won't have to stand in that position, but we should be documenting everything that we are doing, everything we are seeing in a clinical setting while we are at work. Okay, so that's just my a few contributions about what a good nurse would be. Let's move on. So what we did now, when we discussed about this, is we formulated a skeleton of a nursing care plan. That would be part of a formal nursing care plan in a clinical setting. Okay. Can I give you a few pictures, and I just want you to have a look at them and tell me what you feel from it. Like we talked about the nursing care plan format before, so we'll just go through the pictures and let's write down a few points about what the assessment would be, what the nursing diagnosis, implementation and evaluation would be. Yes? I'll give you 3 pictures. I've written the numbers in there. And if you could note it down in here, we'll do it together.
Okay.
So what do you think is going on in that person's mind? What feeling? What emotion?
He's feeling tired. I
Tired?
think he's pain.
That's okay. Everyone will find different perceptions, isn't it? You can say what you feel like. So do you think that person looks tired?
I think so.
Yeah. He's sitting,
He's
or you
thinking
can
of-
say
He's-
that patient, sorry,
I think he's thinking of something.
that person is sitting there with the hands in their chin,
Yeah,
isn't it? That's what you're seeing.
that's right.
So you can put that in the assessment part. If you could write that down in the assessment part, that the person, so you just put number the
In the
pictures.
assessment.
Yeah.
Yeah.
So the number 1 picture, in the number 1 picture, just put number at 1.
Yeah.
Yeah. So the assessment is you're seeing a person sitting with their hand by the chin, isn't it? And then what will happen after that? You can say that the patient is sad. You're going back and you're reading the history of the patient, and then you understand that he's in pain, or he has got an incurable disease or something. So the nursing diagnosis can be the patient is sad because he is having a painful diagnosis. Yeah, you can say the patient is sad. So what's the next thing? You have to plan to do something, right? The planning would be the goal as well. I'm sorry I didn't discuss about that part before.
Yeah.
So the planning would be when you do an implementation, you need to have a goal in your mind. You need to think, okay, so when I do what I'm going to do, this is what the outcome is. So when I go and talk to this person after spending some time with the person, I would like this person to be a bit more happier. So what are the planning and the goal?
So we need to make sure, we need to do something for the person to be happy.
Yeah, for the person to be happy.
Yeah.
That would be our planning. That's the plan. That's the goal, isn't it? And then what we do for that? We have to implement something. What can we do? Spend some time, one-on-one time with the person. You can put that in there, that we have to spend one-on-one time with the patient. And then how do we find out what we did worked or not?
We as for the evaluation, we need to evaluate whether the person is feeling happy after that.
Yeah.
Conversation.
So how can you find that out?
I can ask them.
You can ask. Yes, that's asking for feedback, isn't it? So asking feedback, or you can see the patient smiling, or being not as withdrawn as before. Okay, so did you understand just a bit of like formatting a nursing care plan there? Later on, if you could go through the other pictures as well, and then find out, just make a format of the nursing care plan there, that would be great, and we'll correct it later. Quickly, that person here looks like she's sad, or she heard a shocking news.
Shocked.
Yeah? And then, what about the kid?
He's looks like he's helpless.
Yeah. Or he's
Don't know
numb.
he's numb.
Would you call it he's numb or sad inside? Yeah, so those are, if you could spend some time later and write it down for me, that'd be great. Okay, so that's that. Let's move on and do a fun activity here. Yeah. This would be part of the assessment as well for the training session. So now what we're doing is a PowerPoint quiz. I will just start with that. Hope it's a fun time for you. Okay. Can you see that properly?
Yeah.
If you could read that out, please.
The nurse completes a thorough assessment of a patient and identifies a nursing diagnosis. Which step will the nurse take next in the nursing care plan?
So the first step the nurse is doing is a nursing diagnosis. What would be the next one?
So
is it going to be
I would probably say that the nurse should plan something. So it's planning.
Planning. So D, planning. Yeah, there you go. Okay. The second one.
A patient states, "I have a terrible headache." You observe him rubbing his forehead and having facial grimaces. Which part of nursing care plan is this?
So you're seeing the person, you're watching him rubbing his forehead, and he also says that he has a terrible headache. What part would be that?
Assessment?
Yes, you're assessing the patient, right?
Yeah.
That is assessment. Third question.
A 10-year-old patient is admitted in medical ward with a diagnosis of pneumonia. What nursing implementations can be used to support the patient?
Can we tell the patient that everything will be okay?
Probably not.
Yep.
Because we don't know.
Yeah, that's right.
Educate and support to deep breathing and coughing exercise. Tell the parents that they shouldn't have let their son right now.
What would you say? That's a good one. That probably shouldn't happen, isn't it?
No. Suggest the patient, such family and medicine that have helped you in the past. No.
Again, something that we are not.
I'd probably go with B. Educate and support to do deep breathing and coughing exercise.
Yes. There you go. Okay. Some deep breathing there, some coughing there.
You document that the patient's oxygen saturation has improved from 92 to 96 in room A. Audible wheezing not present currently. Which part of nursing care plan is this statement?
So you did something and then you found that whatever you did helped the patient, right?
Yep.
So how do you find that out? What did you do to find that out?
I think evaluation.
Evaluation. There you go.
You are allocated a patient diagnosed with gout. The patient is having decreased mobility issues. What are the possible steps in planning stage of NCP?
Which is the nursing care plan.
Nursing care plan, okay.
Can we make is that a realistic goal when we say the patient will start walking by the end of the day?
No.
That may not be possible, isn't it? Can we say the patient can use a buzzer whenever necessary? That's,
you need to give help for the patient, but
it shouldn't be falling, the whole responsibility of getting better shouldn't be falling on the patient themselves, isn't it? We have to do our part as well. What about the third one?
Increase mobility level by the end of the day. I would say educate an active and passive mobility exercise. I would probably say D, because we need to educate them the mobility exercise. Or
what do you think is different in that? We are saying educating, we are doing something. Would you say that's the implementation part? You're doing something, that would be the implementation part, right? You are making a goal. Increase the mobility level by the end of the day.
Okay.
Would you think that would be a good?
Be a goal.
That's a goal, isn't it? That's a plan. There you go. So slowly and gradually we can try and increase the mobility level of the patient. Yes. There we go. That's a good job. Was that fun?
That was fun.
So now we just basically went through a format of a nursing care plan.
Yes.
Can you, after learning the the care plan format, can you tell me some of the real life scenarios? Like you have been to probably hospital yourself as a patient. You might have taken your family members to a hospital. Can you tell me about some of the scenarios where you found a nurse use a nursing care plan format that you found helpful? When was the time
I've been to a hospital with my child.
Yes.
I went to emergency department.
Yes.
My son has got I think it looks like it's a spine bite on his leg. I don't know what happened, but it was just got swollen leg. So I took him into ED, and a nurse assessed him. And
how did she assess the kid?
She just had a look at the leg, and she did some paperwork, and she had a look at the leg, and she asked me whether I have given any medicines. I said no, I haven't given anything, because I took him straight away to ED, because I don't know what bitten. She
found you looking worried. She found the kid in pain.
Oh yeah, of course. She was actually
so she
really
assessed.
pleasant face, and she was she was talking to the child like she was playing with the kid.
Yeah, she was attending.
Yeah.
Yes. So she
She
assessed.
was not worried as well. When we see a solid leg, basically I don't know what to do because I don't know. But as a nurse, I think she did a good job. She didn't make me frightened, and she didn't make the child frightened. She was so
She looked
pleasant.
confident
Yeah,
as well.
and she was pleasant.
There you go.
And she was a bit of a playful with the child. She was a small child.
Yes.
So I feel comfortable after her approach towards my child.
So she assessed the condition. She found you worried.
Yeah.
She found your child worried.
Yeah.
But then she made a diagnosis. Would you reckon? Like she made a nursing diagnosis that you are worried because your kid is in pain.
Yeah.
The kid is in pain because he is crying.
Mm-hmm.
Yeah. So she probably might have gone through. It's not as formal as you see, but it's just the way a good nurse would work, isn't it? She's finding you. She's looking at you. She's trying to deduct what's going on in your mind, what's going on in the kid's mind. And then she's understanding, okay, so this is probably what's happening. And then she's planning or making some goals.
Yeah.
I want to make the parent a bit comfortable. I want to help the kid by lessening his pain or escalating the care to a doctor.
Yeah.
So she's triaging probably, isn't it?
Yeah.
So she's making some goals. And then she's doing something to reach that goal. What did she do? Did she get you in contact with the doctor?
Yeah, she called the doctor straight away. At the same time, she was asking some questions where were the child, and I said he was outside playing in the backyard. And she asked me whether I was present during that time. I said, yeah. I said, I was there. So she then told me, so it's definitely not a snake. So that actually made me happy, right? Because then she told me, oh yeah, that's good.
Yes.
So there's nothing to worry.
So she escalated the care to a medical person, isn't it? A doctor. So she implemented that part to help you.
By the time the doctor came, and she explained everything, what happened. And the doctor said, oh, that's easy, that's a simple thing.
Okay, so that's what she implemented. And how did she evaluate? How did she find out that what she did helped you? Did she come and talk to you later? After the treatment?
After the treatment, after the of course, my child has got some pain relief medications, and child is happy.
There you go. And the nurse found out that the child is better now. You are much less worried now. So that's the evaluation that she did, isn't it? So that's something a nurse, a good nurse, would you consider that? A good nurse would do to help her patients, isn't it? So that's just the real life scenarios that we found, we go through in a clinical setting day to day without knowing a nursing care plan is involved in it. No matter if it's a nurse or a doctor or any medical person, I would say it can be used in non-clinical scenarios as well. For someone to find out, to understand what's happening, to plan some goals, to implement something to help that person, that client, and then evaluating, did that work? Did it make any difference? Or what can I do better next time? You know, and then documenting that part as well. Last but not the least, documentation is a big part as well, isn't it? So can you picture a nursing care plan in your mind now? Okay. So that's what that's what we covered today. Just formulating a nursing care plan. And I hope next time you go to a clinical setting, you can hopefully go through a nursing care plan in your mind. You don't have to write it down like we did. Sometimes some clinical areas, they ask you, that's just a part of the job, that you have to make a written nursing care plan like you did before. So that would be part of the work as well. But even if you're not writing it down, just in your mind, if you could just go through that nursing care plan steps, which will be part of which will be a step towards you becoming a better nurse in the
Yeah.
future as well.
Yeah.
Any other questions that you want to ask?
No, I think I got a basic knowledge about how to be a nurse and what to do in a clinical setting
Okay.
with the care plan. Yeah,
There you go.
really good.
Thank you for your time, Robin, and we will catch up again for the next session.
Yeah.
Okay. Thank you.
Thank you.
Robin, before we conclude, well, can I ask you to take some time to write down a feedback
Sure.
as well,
Yeah.
please? One for the session, what do you find if it helped you? And also the one for the assessment. So the assessment was the quiz, online quiz that we did. Did the assessment, did the formative assessment that we did that help you? Did that yeah, so if you could note some of that in here, please. That would be great.
Sure.
So we will meet again for the next session
Yep.
at 12:30.
No
Is
worries.
that okay?
Yep.
Thank you.
Sure.
Thank
Thank
you
you.
again.